Welcome to week 2 of our Back to Sex School, and today we are talking about painful sex, which affects 3 out of 4 people with vulvas. So it's really common, something that can happen intermittently or it can happen regularly for some people, and often it's caused by endometriosis, vulvodynia, vaginismus. Postpartum can cause painful sex, scar tissue from different procedures that happen in the pelvis or intravaginally, menopause, hormonal changes, you name it, pharmaceuticals, birth control, and definitely sexual trauma. So there's a host of things that can cause this. And the core elements that are happening in the body really need to be looked at from a few different perspectives if you're working with painful sex. One is the biological, physical component. Have your hormone levels checked. Low estrogen can absolutely cause a painful kind of like tearing feeling in the vaginal tissues when there's penetration. So estrogen, thyroid levels, any of your biological sex hormones are really important to get checked if you are experiencing painful sex. Second is the actual physical musculature of your pelvic floor. So if you do a lot of Pilates or you do a lot of heavy movement in your pelvic floor, you can have hypertonic pelvic floor muscles that can lead to a sort of gripping and a tightness within the pelvic floor muscles like the piriformis or the obturator internus. When that happens, it can make penetration more difficult and more painful. So learning how to relax and push out the pelvic floor muscles is really, really important and really useful. And this is for people who have been told, to do Kegels too and squeeze and lift. You also have to have the alternate action, which is the pushing out and the relaxing of the pelvic floor muscles to soften that. The third thing to look at is it's the somatic component, which is a little bit hard to describe, but it's the understanding that the body is the subconscious. So our emotional experiences, our actual life experiences impact the way that our muscles interact and the way that our body allows us to either open or to protect itself. And our body has really intelligent protective mechanisms when it comes to penetration. So working with therapists, if you've had any kind of emotional experience or physical experience that was a bypass of a boundary, whether you knew it or not, which often happens, to work with skilled somatic therapists, somatic experiencing practitioners, somatic actual licensed clinical therapists. EMDR is wonderful for working with trauma, complex trauma, early childhood trauma, things like that. And really working with a specialist can have a profound impact. And the fourth suggestion here would be work with a wonderful pelvic floor physical therapist to actually do manual therapy intravenous.